Heavy menstrual bleeding, which is medically termed menorrhagia, is something that impacts so much of someone's life. You can dread your periods. You can spend a ton of money on period products. You can miss activities that you enjoy. You can be exhausted because you're actually anemic. You need to know if something is abnormal so that you can get the help that you need. That's what we're going to do in this video. I'm Dr. Lora Shahine. I'm a double board certified OBGYN and reproductive endocrinologist helping people for almost 20 years. I love educating. If this is your first time finding this YouTube channel, welcome. Subscribe so you get my weekly videos. I talk a lot about fertility, miscarriage, and women's health. I am an author. You can find a lot of content on my website, drlorashahine.com. Follow me on Instagram, follow me on TikTok, and for really great in-depth education, you have found my YouTube channel, so be sure to subscribe. In this video, we're going to go over 4 main points. Number 1, we're going to review what a normal amount of period bleeding is. Number 2, we're going to go over 7 clues to look for to see if you have too much bleeding. Number 3, we're going to go over causes of heavy period bleeding. And number 4, we're going to help you get ready for your doctor's visit. You know what tests to ask about, you know what treatment options may be available, and to really help you be ready if you need to talk to your doctor about heavy period bleeding. So point number 1, how much bleeding should you have in a period? Well, you can describe the amount of bleeding with number of days that are bleeding, how many period products you use, measuring the period blood. In general, people will bleed for about 4 or 5 days. The first 1 or 2 days are pretty heavy, and then it starts to taper off. But when you're talking about days of bleeding, that's really different between different people. So then if you're trying to describe, well, how many period products you use, well, that's kind of hard too, because people use different sizes of period products, and sometimes they're full and sometimes they're not. When it's been quantified and measured, on average, people bleed about 2 or 3 tablespoons through their whole cycle, and a little bit heavier flow, but still normal, is about 4 tablespoons. So how much is 4 tablespoons? Let me show you. I've got some Kool-Aid here, okay? This is 1 tablespoon, 2, 3, 4. So this is 4 tablespoons, which is about 60 milliliters, and this is the total amount of bleeding that most people have in their period. But it's not like you're going to be collecting and measuring at home, so you can actually count up and keep track with your period products. So you can count and keep track with your menstrual cups, with your tampons, and with your pads. With menstrual cups, they usually hold about 30 to 60 milliliters. So when you empty it, you could just measure and kind of keep track. You can look at the manufacturer's website and make sure that you know how much your particular menstrual cup holds. For tampons, a regular tampon holds 5 milliliters of fluid, and a super tampon holds about 10 to 15 milliliters. And for pads, a regular pad holds about 5 milliliters of fluid, but a super overnight pad will hold about 10 to 15 milliliters. So as you're changing your period products, you can think, is this fully saturated? Then you can kind of count it up. If it's half saturated, regular tampon, that's about 2.5 milliliters. It's hard to be perfect, but if you are bleeding more than 60 milliliters of fluid in a period, that is menorrhagia. That is too much. Part number 2, the 7 clues that can help you figure out if you've got menorrhagia and when you should see a doctor about it. Clue number 1, soaking through period products like tampons and a pad within an hour, several hours in a row. That's too much. Clue number 2, having to double up on your period products so that you don't have leakage. That's too much. Clue number 3, having to change your period products in the middle of the night because you're worried about making a mess in your bed. I've had friends that actually set alarms a couple times during the night so they can change their period products. That's too much. Clue number 4, having periods that last longer than 7 days. Clue number 5, having period clots that are larger than the size of a quarter. It's too big. Clue number 6, having such a heavy flow that it prevents you from doing things that you enjoy or being able to go to work or going to school. It's too much. And clue number 7, if during your period you're bleeding so much that you are exhausted, tired, short of breath, these are all signs of anemia. Now, for some of these clues, every once in a while, people can leak through period products or have to change in the middle of the night. You can have a heavy flow every once in a while, but if this is routine and it's happening every single cycle, you're starting to have anxiety about your period coming up and knowing you're going to have to miss activities, these are clues you should really talk to your doctor about what's going on. Third part of this video are causes of menorrhagia or heavy menstrual bleeding. Now, I think about these in 7 categories, and I want you to write them down and take this list with you when you go to talk to your doctor, because I don't want you to miss anything. The first category is uterine causes. I think about anatomic causes like benign growths, fibroids, polyps, and I also think about cancer. Some cervical cancer, some uterine cancer can present with heavy bleeding. Category number 2, pregnancy complications. So you might not know that you're pregnant, but a miscarriage can cause heavy bleeding. An ectopic pregnancy, which is a pregnancy in the fallopian tube, can cause bleeding. Don't want to miss that. The third category I think about for heavy uterine bleeding is hormonal disorders. And I'm mainly thinking about PCOS and thyroid disease. Both of these issues can cause heavy bleeding. PCOS is polycystic ovarian syndrome, and see my playlist here on PCOS. I've got lots of videos here. I can teach you a lot about that disorder. The fourth category that I think about are immune issues like endometriosis and adenomyosis. These are conditions that are often associated with pain and infertility, but they can also cause heavy uterine bleeding. The fifth category, infection. I don't want to miss pelvic inflammatory disease, and I don't want to miss uterine infection, which is often called endometritis. The sixth category that I think about are other issues in the body or illnesses that can affect our bleeding. So you can have bleeding disorders, either something genetic like von Willebrand's disease or a platelet disorder. Platelets really help with clotting, and if they're not working well, it can show up with heavy bleeding. Clotting is really important. Our body is constantly balanced between clotting so we don't bleed too much and not clotting too much so that we don't get blood clots. And if those factors are not being produced correctly in the body because of liver disease or kidney disease, that can show up with heavy menstrual bleeding. The seventh category that I think about are medications. There's certain medications that can increase your risk of bleeding, like aspirin, or blood thinning medications like heparin and Lovenox. And some chemotherapeutic drugs can also change your bleeding pattern. You should also think about some supplements that increase the risk of bleeding. Things like black cohosh, aloe vera, and even more can increase your risk of bleeding. So the tests that your doctor might order could be blood tests, as well as anatomy checkup, as well as maybe some screening for some cancers. So it all depends on your personal history, but the blood tests could include a CBC, that's like a blood count, to see if you're anemic. They could check iron levels to see if one of the reasons that you're anemic is because you have a low iron. Your doctor could certainly check some clotting disorder tests. They could certainly check your thyroid function, and they can do some screening for PCOS. Other types of tests that they might order is looking at your anatomy. So we talked about fibroids and polyps causing heavy bleeding. So they might do a pelvic ultrasound. They might do something like a saline infusion sonogram or a hysterosalpingogram. These are all ways to look at the uterine cavity and the outside shape of the uterus to see if it's an anatomic issue that's causing the heavy bleeding. And then they might do some screening for cancer. They might do a pap smear to look for abnormal cervical cells, and they might do something called an endometrial biopsy. We actually take samples from inside the uterine cavity to make sure that there is not any abnormal uterine cells. So be sure and ask about the tests that your doctor is recommending and why. And if there's any tests that they're not ordering, just kind of get some clarification as why they chose not to order those tests. So things that you can do in preparation for that visit, you can keep track of your menstrual cycles, not only the number of days of bleeding, but when you're bleeding and how many period products you're using. You can try with the information that I gave you to try to actually quantify how much bleeding you're having. That can be really helpful. When you go to see your doctor, make sure you take a list of all the medications you're taking and all the supplements that you're taking. So we talked about a couple of supplements that can cause increased risk of bleeding: the black cohosh, the aloe vera, something called bromelain. Bromelain you might have heard of in my video where I'm talking about why pineapples are a symbol of fertility. Bromelain is an anti-inflammatory substance that's found in the core of pineapples. And sometimes people will eat pineapples or eat pineapple core in the implantation phase to hopefully increase the chances of embryo implantation. There's not great evidence for it, but if someone's taking a lot of bromelain, especially as a supplement, that might actually increase the risk of bleeding with their period. Ginkgo, fenugreek, there's actually several supplements out there that can cause increased risk of bleeding. So look at what you're taking and look online to see if that could be an issue. As you're waiting for your doctor's visit, ibuprofen can really help decrease the amount of bleeding. Make sure you take it as directed. You don't want to take too much ibuprofen because that can have harmful health effects. Try heating pad, try staying hydrated, try eating lots of iron-rich foods, leafy green vegetables, red meat if you eat meat, maybe a multivitamin with some iron in it as you're waiting for that doctor's visit. I really hope that a couple of these tips can be really helpful for you. I know that was a lot of information, but I really want to help you if you are worried about having too much bleeding. So let's recap. In this video, we learned how much bleeding is normal for a period. We learned about 7 clues you can look for if you think you have too much bleeding. We reviewed some causes of heavy bleeding, and I gave you some tips to write down and be prepared for your doctor's visit when you go to ask questions on how you can get help. I really hope you learned something in this video. Like this video if you learned something. Comment with questions that you have. Be sure and subscribe to this channel so you never miss my weekly videos all about reproductive health, women's health, and fertility. And as always, wishing you love, luck, and pineapples.